Good morning, Doc. My name is Mary Angelisa Buero, and I'm gonna report infection control in oral surgery. Infection control aims to ensure the protection of those who might be vulnerable to acquiring an infection both in general community and while receiving care due to health problems. First, to perform surgery, the dentist typically violates an epithelial surface, the most important barrier against infection. Second, during most oral surgical procedures, the dentist assistants and equipment become contaminated with the patient's blood and saliva. There are 7 aseptic techniques. First is the terminologies. Sepsis is the breakdown of living tissue by the action of microorganisms and is usually accompanied by inflammation. Antiseptics and disinfectants. The difference between these two is that antiseptics are applied to living tissues, whereas disinfectants are designed only for use in animate objects. Sterilization and sanitization. Sterilization is the total wipeout of forms of microorganisms, while sanitization, it only reduces the number of viable microorganisms. Next to terminologies is the concept. Chemical and physical agents are the two principal means of reduction the number of microbes on a surface. The microbes have variable ability to resist to chemical or physical agents. The microorganisms most resistant to elimination are bacterial endospores. A general method of sterilization that kills endospores is also capable of eliminating bacteria, viruses, microbacteria, fungi, and parasites. Next is techniques of instrument sterilization. There are 3 methods of instrument sterilization. These are dry heat, moist heat, and ethylene oxide gas. And here is the comparison of the dry heat and moist heat. Sterilization with gas. At 50 degrees, ethylene oxide is effective for killing all organisms, including spores, within 3 hours. Next to instrument sterilization is instrument disinfection. Many dental instruments cannot withstand the temperatures required for heat sterilization. Therefore, if sterilization with gas is not available and absolute sterility is not required, chemical disinfection can be performed. There are 3 levels of disinfecting instrument. First is low. It reduces overall number of vegetative microorganisms but do not destroy tubercle bacilli or bacterial pores. Agents used are phenolic disinfectants and quaternary ammonium compound. Second, intermediate. It kills vegetative microorganisms including Mycobacterium tuberculosis and inactivates most viruses. Third, high. Kills vegetative microorganisms and inactivates viruses, but do not necessarily high number of bacterial pores. The 5th aseptic technique is the operatory disinfection. Any surface that a patient or patient secretions contact is a potential carrier of infectious organisms. The operatory can be disinfected in 2 basic ways. First, to wipe all surfaces with a disinfectant solution. Second, is to cover surfaces with protective shields that are changed between each patient. Next is the surgical staff preparation. There are 2 basic types of personal asepsis, the clean technique and the sterile technique. The last aseptic technique is the post-surgical asepsis. The wound management. Wounds should be inspected or dressed by hands that are covered with fresh, clean gloves. And the sharps management. During and after surgery, contaminated materials should be disposed of in such a way that the staff and other patients will not be infected. That is the end of my report, Doc. So before performing surgery on a patient, we have to be cautious with the things we are using as to not let them get infected.